you'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with the information you hear. Now look at the notes for extract 1. Extract 1, questions 1 to 12. You hear a dermatologist talking to a patient called Nigel McNess. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
So, Mr. McNess, I have your notes here, but perhaps you could tell me in your own words how the condition developed, the treatment you've had, and anything else you think I should know.
Sure. Well, I've got these skin problems which seem to be getting worse. At first, I thought I had dermatitis or maybe even a fungal infection. I'd had something like that as a child. Then I started noticing these thick red areas on my skin. They're sort of a little raised, I guess. They just got worse, and the affected area got bigger and bigger all the time. I was a bit worried that it might be contagious, you know. I was worried I'd picked up something from one of my young nieces. I see them quite a lot.
And these patches are...
They're mainly on the outside of my elbow and over my kneecaps. Oh, and on my neck.
Right.
I've been wearing long-sleeved shirts and jeans to cover them up, but I can't hide those, so everyone can see them. They're also very painful. Sometimes it feels as if my skin's burning. It's very itchy as well. I try not to scratch it, but it's almost impossible, especially at night. Sometimes it's so bad that I find it hard to get comfortable and I can't sleep. It leaves me tired most of the time, and that has an impact on my work during the day, quite apart from the embarrassment of the symptoms themselves. I'm a tour guide, you see, so I'm very much in the public eye.
Yes, I imagine that it's been difficult for you. Have you tried taking anything?
Well, I tried to fix the problem myself at first. I bought some cream from the pharmacy to see if that would help. Sorry, I can't remember what it was called.
That's okay.
It didn't do any good anyway. So I tried a non-allergenic soap, but that didn't make any difference either. I just want to get something which will clear this up.
Yes, I understand. Are there any other health issues I should know about? Maybe when you were a child?
Not really. I used to get acne as a teenager, but no worse than anybody else, and it cleared up by itself, really. At the time, you're very aware of these things, aren't you? But I haven't had any other problems like that. But there was something else that I didn't tell my GP about. I'd forgotten about it because I hadn't been to see her about it. I went away on holiday with a friend the summer before last, and we managed to pick up scabies from one of the cheap hostels we stayed in.
Right.
I was covered in a rash. It was extremely irritating at night. Now I think about it, it was all over my body, especially around my midriff. It looked like I was covered in little pimples. Fortunately, we got rid of it using a lotion from the pharmacy, but I never mentioned it to my doctor.
I see. And any other health problems?
Oh, I did have a bladder infection a while ago, last year I think, but I haven't had any problems since then. Do you think that could have caused my current problem?
I shouldn't think so. You're probably aware that this is quite common, and I noticed that your GP sent away a urine sample for testing before referring you to me. The results are quite normal, so I wouldn't be concerned at all.
Well, that's something, I suppose.
OK, well, as you say, it's different from your current symptoms. What about the effect your current problem is having on your general mood?
I'm just sick of dealing with this. It's really knocked my self-confidence a lot and affected my body image so that I don't go out much anymore. I have to go out to work, obviously, but I sort of keep away from people as much as I can. I think because everyone can see I've got a problem, it's stopped me from doing things like playing sport or swimming. I feel lonely most of the time and a bit depressed, if I'm honest. I'm also concerned that I haven't started any treatment at all. I'm hoping that it's not too late now.
I can appreciate your concerns. Now, what I'd like to do is give you a skin biopsy as soon as possible to see exactly what's going on. I think we can book you in for that early next week. Once we get the results, I'll be able to get you started on some...
Extract 2. Questions 13 to 24. You hear a physiotherapist talking to a patient called Greg Freeman, who's been referred to her by a sports medicine clinic. Questions 13 to 24. Complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
OK, Greg, so I have your notes from the sports medicine clinic, and it looks as if you've had quite a few problems in recent years.
Yeah.
Would you like to talk me through them?
Okay, well, the first time I got hurt was 2 years ago. I took a fall while I was rollerblading and I hurt my right wrist here on the side. So I didn't do anything right away, but next day I went and saw the doctor and they gave me an x-ray, but they said they couldn't see anything wrong and they just gave me some exercises to do.
Right.
Then a year ago, I hurt my right shoulder here when I came off my snowboard and hurt myself. That's never really gotten better.
And I understand you've had about 10 visits to the clinic over the last 2 years. So that's your right wrist and shoulder?
Mm-hmm. And other joints too.
Tell me about this pain in your shoulder. Is there anything that makes it feel worse?
Well, I like to do a lot of exercise, but that definitely makes it worse. Like if I do a set of pull-ups in the gym or rowing, or if I'm using the free weights, pretty well any sort of exercise I do, I find the pain's pretty bad.
Right.
And it's not just when I'm in the gym, it's constant, all through the day. There's no fluctuation, so I never get a break from it. It's really got me down, and no one seems to know what to do about it. They've diagnosed various different things, and I have to lie on my left side at night, or the pain disturbs my sleep, so that's not easy.
So, apart from that, are you generally in good health?
I suppose so. But what I've noticed is that my right wrist sometimes feels cold,
OK.
and there's no reason I can see for that. And the same for my left knee. It suddenly goes cold. It's very strange. When I told the doctor about that, he checked to see if the blood flow was okay, and it was.
Right.
And he asked if I felt any numbness there, but I don't.
OK. That's quite strange. And have you had any medical problems in the past?
Well, the only thing really is, I used to have really bad acne. It started when I was about 13, and I got it on my face, and then it spread to my back, and nothing I did seemed to have any effect on it. Like, first, my mom went to the pharmacy, and she got this stuff I rubbed on. I can't remember the name. It was something peroxide.
Benzoyl peroxide?
Yeah, that's it. But that didn't do any good, so my mom took me to the doctor, and he gave me antibiotics, and they didn't do much either. Then I read this article. that said it can be caused by your diet and you should cut out dairy products. So I did that for a bit, but it just got worse. And it got so I didn't want to go out or anything. So then my doctor referred me to the hospital and I saw a dermatologist.
Mm-hmm.
She was really nice and she prescribed me some stuff that was much stronger, and that did have an effect for a bit, but I got really dry lips and they started cracking and bleeding.
Okay.
And another side effect, well, she said she wasn't sure it was due to the medication, but I think it was. Every so often I started getting this awful depression. So in the end I stopped taking anything, and it seems to have sorted itself out.
Yes, your skin looks fine now. Right, so let's have a look at this shoulder of yours. Can you take...
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
Can I help you?
I'm having a lot of trouble sleeping lately, but I don't want to take sleeping pills. I've heard about herbal remedies. Would you recommend them?
There are quite a few products available which are not drug-based, but it's important to remember that any medication should not be used for a chronic problem. It's always wise to see your GP in these cases.
So you're saying that I should talk to my GP to check if I can take these tablets with my other medication?
Yes, you should be extremely careful if you're taking anything else at the moment. Let's have a look at your regular medication list and I can tell you now.
Question 26.
Mrs. Nora Eastman is being transferred to your care home tomorrow, so I'd like to hand over her details now, if that's okay.
Sure.
Mrs. Eastman had a stroke about 2 weeks ago and now has considerable cognitive impairment and difficulty mobilizing. Before the stroke, she had some short-term memory loss, but this has worsened since the stroke. She needs help with her personal care, as she often forgets to do it. We find that if you turn on the shower for her, she's able to manage the rest by herself.
Okay.
She still has quite a lot of left-sided weakness and is unsteady on her feet. She has a quad stick, which she should be encouraged to use whenever she walks around. She often needs to be reminded to use it. It's not familiar to her yet. Another thing I should mention is that Mrs. Eastman is a little anxious about the move to a care home and worries about her loss of independence. That she'll need a lot of reassurance when she first moves in.
Yes, she will. Thanks for the handover. We'll be ready for her transfer tomorrow afternoon.
Question 27.
If everyone's ready, I'll do the safety brief. The first thing to mention is an infection control issue. Mr. Dawson had several episodes of diarrhea and vomiting during the night shift. A stool specimen has been sent to the lab to be tested. We're expecting the results tomorrow or the day after. Mr. Dawson has had several operations on a serious hand injury and is therefore at high risk of a C. diff infection. Until we get the results, he'll be on special precautions and he'll remain in isolation. He was due to have a CT scan this morning, but this has been rescheduled for next week.
Okay.
He also has to have his wound review today, and that can't be changed. All the dressing equipment has been left in the isolation room, and personal protective equipment is available outside the room.
Right, thanks.
Question 28.
So now I'll tell you about what will happen during the scan. Do you know what to expect?
Not really. I'm a bit uptight about all this, to be honest.
That's okay. It's quite common to feel apprehensive. The scan itself takes about 30 minutes. An hour beforehand, you'll have an injection of a radioactive tracer into your vein. Then you'll lie on a scan table and be placed into the scanner. It's a bit like a tunnel. It's not painful, but some people feel a bit uncomfortable lying still for that length of time.
What if I get really anxious or feel sick?
If you feel unwell at any time during the scan, just press the buzzer and we'll come and help you immediately. We can see you at all times through the window over there.
Question 29.
I'll give you some information about the maggot dressings you're going to use on Mr. Dutton's wound. The dressing technique is quite new, so many nurses are unfamiliar with it.
Yes, I'm afraid I don't know much about it.
Well, the evidence is out, and the maggots seem to be very effective in cleaning wounds which are hard to heal. There are two types of maggot dressings, free-range maggots and maggot bags. You'll be using the maggot bags as they're easy to use.
I see.
After placing the maggot bag on the patient's wound, cover it with a pad. It needs to be moist but not wet. Leave the maggot bag in place for up to 5 days. When you take off a used bag, dispose of it in a clinical waste bin.
Okay.
Question 30.
I need to go through some important information about the patches you'll be using for pain relief at home.
Oh, yes. I'm changing from the tablets I've been taking.
From now on, you'll use a patch for several days. This will release the medication slowly into your bloodstream.
Okay.
That should help control the pain you've been having lately. There's one important thing I need to stress about what happens when you take off the old patch. After you peel it off, make sure that you fold the edges together so that both sides of the patch stick to each other.
Why's that?
The used patch can still contain some of the active ingredients of the drug, which can be harmful to children if they touch it. By sticking the patch together, you'll seal in any of the remaining medication.
Oh, right. I see.
This is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1. You hear an interview with a dietitian called Megan Fowler, who's talking about a study of trials on the effects of omega-3 supplements. You now have 90 seconds to read questions 31 to 36.
A large number of people take omega-3 supplements in the hope of preventing heart attacks, strokes and other cardiac and vascular problems. But how effective are these supplements? With us today is Megan Fowler, a dietitian who's here to tell us about a recent study into the effectiveness of these supplements. Megan, tell us about the findings of the omega-3 study.
Well, it was a massive study, pulling together the results of trials that had been carried out on both fish oil and plant-based omega-3 supplements, and also on the consumption of oily fish. And the findings were a bit of a shock. It turns out that these supplements have no effect. The researchers looked at a total of 79 studies carried out over 8 years and involving over 100,000 people. If these supplements were reducing our risk of heart attack or of stroke, this would have shown up, so it turns out that they're not harmful, but they're not beneficial either.
And what did the researchers find out about the effect of the supplements on triglycerides?
Well, it's long been thought that these supplements reduce triglycerides, which are fats found in the blood. Some people are prescribed omega-3 capsules for this purpose, and the researchers did actually see a reduction here. But what the study didn't uncover was any of the later results that might have been expected from this, such as reductions in heart disease or different effects on stroke. So they were a bit perplexed about this.
Now, the earliest suggestions that fish oils might be beneficial came from studies of the Inuit diet, didn't they?
That's right. Somebody had the idea of going to look at the Inuit people living up in the far north, as they didn't have many heart attacks, and for some reason, the researchers fixed on the idea that it was the fish in the diet that was creating that reduction. So they went with that and they did a couple of early small trials. One of them gave the subjects more oily fish to eat and the other gave fish oil capsules. And they looked very positive, these early trials, so people got very excited about that, even though subsequent trials, and as I said, there were 79 of them altogether, subsequent trials didn't show these effects at all. It's really interesting how an idea can stick when people want to believe it.
So does that mean that there's no benefit from eating oily fish either? Whole fish?
The study doesn't provide any good evidence that there is, But most of the research was on supplements rather than the effects of eating whole fish. My guess is that there are lots of good things in oily fish. It has omega-3 fatty acids like EPA and DHA, which you get in supplements, but it also has protein. It has selenium and iodine and calcium and all sorts of things that we're sometimes short of. But we haven't got evidence from the study about the cardiac effects.
But I believe there have been complaints from manufacturers of these supplements who've questioned the doses used in the study, saying they were too low.
The dose question is a really interesting one. The manufacturers claimed in their official statement that all the trials were under 1,000 milligrams a day of EPA and DHA, but that was simply not the case. Out of the 79 trials, 17 had doses under 1,000 milligrams, as they say, but the remaining 53 had doses above that level, up to 5,500 milligrams per day. So they had a really good range of doses in there, and they looked really carefully to see if there were more effects in the trials that had higher doses. And they found whether you take a high-dose omega-3 supplement or a low-dose omega-3 supplement, there just isn't an effect coming through.
Right. And what about the claims of manufacturers that not enough attention was paid to individual variations in absorption of the supplement?
Well, of course, there are individual variations. When most people start taking an omega-3 capsule, most of the types of fat in their body will equilibrate to that quite quickly, but some people take a little bit longer. So the researchers made sure that they only considered trials of at least a year, because some people take almost 6 months for the fats in their body to equilibrate. And that gave the researchers 6 months for the fats to get sorted out in the body, and then another 6 months to begin to reflect any health effects that they were seeing. But some of the trials are much, much longer than that. They can be up to 8 years. So any equilibration that people are going to experience is definitely going to happen in that time.
Now look at Extract 2. Extract 2. Questions 37 to 42. You hear a GP called Dr. giving a presentation on the subject of social prescribing. You now have 90 seconds to read questions 37 to 42.
Hello, my name's Georgia Sims, and I'm a GP working at a practice in a small country town. My special interest is community mental health, and my presentation today is on the subject of what's called social prescribing. I've been involved in a community health project which has been using this and which seems to be making a difference to the well-being of some of my patients. The project was inspired by the recent initiative that encourages GPs to include social prescribing in a patient's therapy. GPs are now able to write a prescription that allows a patient to attend one of a number of activities, each of which focuses on sociability and the feeling of belonging to a community. The activities encourage patients to link in with non-medical sources of support in both indoor and outdoor contexts. When I first heard about social prescribing, I had some concerns, but I was still keen to explore how it might be of help to my patients who suffer from moderate levels of depression and anxiety. I identified 3 long-term patients who often spoke of loneliness and feelings of isolation in addition to their mental health issues. But I was a little worried that the effect might be to reduce the input of GPs in patient care and cut back on the amount of direct contact GPs have with them. But after reading about various social prescribing projects that had been underway for a while, I realised this wasn't the case. Indeed, I began to see that my having the ability to prescribe a social activity would be helpful to my patients. Although there are several activities that lend themselves to social prescribing, like walking or singing in a community choir, I decided to go with a gardening project for several reasons. I'd already been contacted by the manager of a well-established community garden, which is tended by volunteers. Unfortunately, some volunteers had recently moved out of the area and more needed to be recruited. The garden is located close to public transport, which was an important consideration as none of my patients are able to drive for medical reasons. My hope was, of course, that the activity would improve their physical health. I'd previously encouraged them to try keep fit sessions, but this hadn't been a success. But I also hoped that being out in the fresh air in a non-threatening environment would have a positive emotional effect on them too. I was cautiously optimistic about the benefits to my patients of becoming involved in the gardening project. However, I was concerned that the hard work involved in digging a garden might be a daunting prospect for some of them, particularly those who had physical limitations related to health conditions. For example, one patient had undergone knee surgery the previous year and was understandably cautious about digging. Another patient has chronic back pain and was therefore unable to bend or stoop down. It was important to make sure the project manager was aware of their limitations and could tailor the activities to suit the patient's abilities and reassure them that the activities were indeed within their capabilities. After the first month of the project, I spoke to each of the 3 participants individually and was pleased by their feedback. All reported that they were enjoying an enhanced sense of well-being. They all admitted that when I first talked to them about the gardening project, they'd not expected to enjoy being out in the fresh air as much as they eventually did. This was the most welcome news for me. All other attempts I'd made to get them involved in such activities had been unsuccessful. One patient added that he left the gardening project each week feeling that it was a job well done. And I was very happy to hear that all 3 felt they had more self-confidence and felt that the future was brighter for them as a result of taking part. It all boded well for initiatives we might go on to set up. Looking back, I realised that I'd been unnecessarily sceptical about prescribing activities that were already available in the community. After all, I'd reasoned, people have been able to join all sorts of community projects on their own for a long time. Why would a GP's prescription make a difference? Something that one patient said, however, brought home to me the value of social prescribing. When I asked him how he felt about being involved in the gardening project, he said, "Without your gentle push, I'd never have considered it." When I asked him to explain, he said that it was like any other prescription I gave him for his condition. He trusted my expertise and viewed my social prescription as another part of his treatment. This, above all, has convinced me that social prescribing is a valuable addition to a range of mental health therapies.
That is the end of Part C. You now have 2 minutes to check your answers. That is the end of the listening test.
You now have 2 minutes to check your answers. That is the end of this listening test.